Patients. Hi, I'm Raquel Durban. I'm a registered dietitian in Charlotte, North Carolina. I appreciate you guys joining. I really have a lot of passion for dietetics in the field of food allergy, and I will say that Egypt's patients are one of my favorite populations to work with because we build a great relationship and we have a lot of dialogue that's really open and honest, and you just build this nice rapport with these families and patients and individuals. So tonight, I'd like to go through the objectives for us to get started. And we're not going to go in this order, but kind of what I'm hoping that we'll cover is how to eat intuitively. So eating with intention. When we go food shopping, how do we gather ingredients? Like, what are we looking to buy? How do we look at the label? What goes beyond the ingredients that we can pronounce? With any food elimination, including a single food elimination, there are always going to be nutrient opportunities. And I want us to identify what those opportunities can look like, and then how do we bridge those gaps? And how we get to that place is through a dietary assessment. And there are specifically 4 steps related to a dietary assessment, but you guys will get it. It's A, B, C, D, and we'll go through what those letters each mean. And then if we're not able to fill it through a nutritional source, how do we supplement appropriately? What does that look like? Chewables, liquids, vitamins, formulas, over-the-counter protein powders, just kind of going through safety and what we're looking for. So let's start with the dietary assessment. I found this picture and thought it was exactly how I think, because when we think about nutrition, we always think that the strawberry is a better choice than the marshmallow. But sometimes you just want the marshmallow, and that's not a bad thing. It's, trying to make that teeter-totter a little bit more balanced. But marshmallows are delicious, and so are strawberries. But if you have oral allergy syndrome or another food allergy that doesn't allow you strawberries, and you used to love them and they're super juicy, then maybe the marshmallow is what you're looking for. So when we go through this dietary assessment to figure out, do I need more marshmallows or more strawberries, we start with the anthropometrics of a child or an adult. So we're looking at current growth, height and weight, head circumference for infants, and then we're looking at where have you been and now where have you gone, to make sure that you're following your own curve. Sometimes I hear parents say, oh, 5th percentile. And I remind them that their kid was in the 3rd percentile last time that I saw them. Or maybe it was the 7th percentile for weight, but now they've grown in their height percentiles. And I know one body is always going to be doing the same thing. So we're just capturing you in a moment in time. That's why that history is so valuable. If we're really concerned, then we can draw labs or biochemical data. And we're always looking for, that's why we love to see you in person, even though virtual appointments are excellent. Sometimes I'll ask for my virtual appointments to send me pictures like of hair or fingernails, because we can actually notice physical signs of vitamins and mineral deficiency through a physical-based exam. And we also go through, what does your day-to-day look like? Tell me about other medical conditions that you have. And that's when we finally culminate all of it into a dietary analysis, where we're either maybe doing the 3-day food record with the 2 days during the week and 1 day on a weekend, or even a 24-hour recall to just kind of capture what you're eating in a day. In all of this and making your plan moving forward, we also consider how long it took you to get diagnosed, because that can also modify what you're eating. We think about, what is your access to food? If I suggest that you go to your local specialty fancy grocery store and buy XYZ product, but you don't have that nearby, I'm not a very helpful dietitian. And do you have a safe place to prepare it? For my kids living in a dorm, the situation is a lot different from when they're living at home or when they're living independently, maybe in an apartment off campus. And even if they know how to cook. By the way, YouTube has great videos on something as simple as how to chop an onion. That was one of the first videos I started with one of my clients, just trying to teach him the fundamentals of cooking, how to cut chicken against the grain, with the grain, or even knife skills. All of that can be found online. So those videos, can teach somebody how to eat for a lifetime. When we collect all of this data and we're working with our allergists and our GI, we're also helping in that shared decision making with the team on how do we determine the diet direction. So, one, can we actually adhere, which can be super hard if you're playing sports or you're doing lots of after school activities, or it's just really hard because all your friends are going out after school to eat, or you work outside of the home and you don't have a refrigerator where you work. And how much can you really pack in a big cooler with how many ice cubes? Um, so, when we're thinking about that in all of your day to day, that's also where we're reflecting back on all that data that we've just collected and considering what foods you are willing to and have access to and can afford to eat, how those are going to give us value, variety, inclusion, and versatility. For those patients that we see that have feeding difficulties, this is not ARFID, which I want to discuss, but let's just pause here and take into account that many families and patients with EGIDs experience feeding difficulties. And we try to approach those with our teammates, the speech language pathologists and occupational therapists, by looking at the different strategies. And so the different strategies can be the division of responsibility, which is a principle by Ellen Satter. And Ellen Satter's principle is the parents decide what goes on the plate and the child decides what to eat. It's a little bit more complicated than that. So working with your provider, your dietitian, your SLP or OT to help you. There's also sequential oral sensory, and that's going from the different types of ways of processing the food or putting it on the plate. And then food chaining is when you go from, let's say you start with ketchup and then you move up to a tomato sauce with a few bumps and lumps in it. And then eventually you're working your way up to getting to a full tomato or slices of tomato. So there's many different ways to approach it, and that's the benefit of working with a OT or SLP. Now, ARFID is different. ARFID is a feeding disorder, and it's in the DSM criteria for psychologists and psychiatrists. It's also in the medical diagnoses for the ICD-10 codes or our diagnostic codes. And this is much different. So ARFID is when the restrictions to the diet are not because of lack of availability of food, like food insecurity, or sanctioned practices is according to their religious preferences or personal beliefs. And it's not with a concurrent medical condition. So if your EGID is in remission, that's when we want to approach ARFID because, or even feeding difficulties, because trying to feed somebody who's not feeling well is really counteractive and can lead to even a harder experience for these patients. So one or more of the following has to be met. But really what it comes down to is that they are not food insecure, they're not doing it for religious or ethical reasons, and they are in remission. So that's where I like to intervene, although talking to a patient about this is really critical to prepare them for what's to come. So we just finished talking about food restrictions. Let's talk about how that goes into our growth challenges. Beyond ARFID, beyond truly having feeding difficulties, there's also mealtime habits. Who do you eat with? Where do you eat? Like in front of the television, on the couch? Are you sitting in a chair where your feet are not touching the ground? If you sit in a chair, if you're sitting and watching this, and you lift your feet up and you try to sit balanced and practice eating, you'll notice that your core becomes a little shaky. And that's how kids can experience when their legs are too short to touch the ground. So they can either tuck a foot underneath them or you can put a little stool under them. I like to use yoga blocks or rolled up towels for the babies. Are the parents eating what the child is eating? Is there a partner who's sharing that meal? They're eating something very similar. Sometimes we actually see obesity because the safe foods can sometimes be lower in fiber, less nutrient dense, higher in fat or saturated fats, and sodium as well. So are we getting inadequate or excess nutrients leading to that imbalance like the strawberry and the marshmallow? As I mentioned earlier, if you're busy, you're traveling, you're working, there's so many attributes that affect the direction of diet therapy. And then just knowledge gaps. It's our job as providers to educate you on how to read a label, how to go food shopping, how to make sure that you're doing this right because you're investing a lot of time, energy, finances into this, and we need to make sure you're well educated. So let's look at those nutrient opportunities. Let me teach you, fill in those knowledge gaps of how to do this. So energy is essential, thinking like energy equals calories. But at each age and stage, we require different nutrition. And when we go online and we read about nutrition that we need, it's often very skewed, very high protein diets, um, or a lot of, I find, easily packaged foods for toddlers. And I think families always feel like they're on their go. So even just teaching how do we shop for easy on the go things that are minimally processed and available, um, shelf stable, easy access. So a calorie is not just a calorie because if we had 300 calories that were primarily fat, sodium, added sugar versus 300 calories that were a nice balance of fiber and sodium and fat and protein and carbohydrate, then it's a much different reward for our body than if it didn't have that diversity. So looking at the micronutrients rather than the macronutrients, which we think of as the protein, carbohydrate, and fat, we're going to zoom in a little closer on those micronutrients. So zinc's role in the body, all of these nutrients have multiple roles in the body, but zinc is really critical in growth. And we see zinc deficiency. And when we're thinking about growth faltering or difficulty with growth, especially height-wise, we might look for labs that are for zinc, so that biochemical data for zinc, because they're part of DNA and RNA synthesis, as well as hormone development and creation for specifically bone development and linear growth. And they work together with our other nutrients in synergy to help their absorption. So the sources of red meat, of zinc, might be red meat, might be difficult to swallow. Beans might be restricted depending if you're doing a soy elimination or an all legume elimination diet. Poultry, seeds, shellfish, fortified grains, all of which could be eliminated from the diet, but you can see there's a variety of sources so we can help to nurture through other sources. Iron plays another role in growth because it's involved in that protein synthesis of our DNA and our hormone formation, even though we usually think of iron as being part of our red blood cells, specifically to iron deficiency. So it takes the energy that we eat from food and it makes it usable for our cells to get energy and start moving and doing their job. The sources of iron, red meat, poultry, seafood, a lot of the same as we were getting for zinc. So you can see those foods are double duty, but also dried fruits, which can be a really fun snack, especially on the go. The dried chickpeas are also very fun, and you can make them lots of different flavors, and you can make them yourself, as well as seeds and quinoa, which is a seed as well. Vitamin D is our sunshine vitamin, but it helps us to keep our calcium regulated and our phosphate regulated. And the appropriate ratios of calcium to phosphorus actually ensure optimal bone mineralization. So in addition to our bone health, which we typically think of, vitamin D also helps to reduce inflammation and is part of cell growth. It comes in two different forms. I think vitamin D3 is what we oftentimes hear about, but vitamin D2 is excellent, and it's found in plants and fortified foods. So they both are an excellent source of vitamin D, but they do have different names because of where they're derived from. And vitamin D and calcium go together like peas and carrots. So calcium we think of again as bone health, but it does a lot of other things in our body. So it's part of our nervous system functioning, regulates our heart rhythm, part of hormone release, and it really creates the structure of our bones, thinking of it like a spine. There are different forms of calcium, just like there are vitamin D. Each one is important and valuable, but they each have different elemental amounts of calcium in them. And then there are certainly food sources of calcium as well. So calcium and vitamin D are what we think of immediately, or at least I do, when we consider a cow's milk elimination diet. And the next thought is plant-based milks. You cannot go food shopping without seeing 50 different choices in the store. A lot of parents are like, how do I pick one? And that's a great question. Oftentimes I have to really dig in to help the families figure out how to pick one. First, you got to be over the age of 1. Second, if we think about cow's milk and what it's providing, it's about 350-ish calories, in 2 cups, maybe a slice of cheese, and or yogurt, plus the vitamin D and the calcium and the other all of those B vitamins, riboflavin, that are included in milk. So if you're not meeting about 2/3 to somewhere in there of your energy needs, that's a complete source of nutrition. Your dietitian might not feel comfortable with you transitioning to plant-based milk. We also want to make sure that you're not going into this um, needing nutrients to be supplemented, and that you have been able to wean from at least 16 ounces of breast milk or 16 ounces of infant formula. So there's a lot of different parts that are moving in making this decision. And while this is a great representation, it really is individualized and should not be used as exactly how we determine that. Plant-based beverages come in a myriad of choices, and that's what I said. When you go down that milk aisle, there's too many choices. And when we think about a plant-based beverage, plant-based milk, we have to consider that there's non-nutrient binding ingredients in it to make it into the product that it is. So there's gums, there's tannins, phytates, trypsin inhibitors, and all of those might latch on to those little nutrients and possibly make them less bioavailable available to your guts. And then the actual absorption of these nutrients from a protein perspective is different as well. So you can see that pea and soy are the most close to milk, but if you're legume avoidant, this might be an opportunity for you to get what you need through short-term or even long-term formula supplementation of amino acid-based formula. There's a lot of varieties on the market, so be open-minded. And if we're not doing this right, and you're hopefully all supported by a dietitian, these are the reasons that dietitians, for many reasons, we exist in the food allergy space. But this is what we're looking at, and maybe not telling you the specifics, but this is what we're thinking in the back of our mind. We want to prevent these things from happening because we know that they can happen. So we take our jobs really seriously, like I would hope anyone on your team would. But we also find it fun, and we find a lot of joy out of improving quality of life. So let's go back to that diet direction, and let's kind of think about the other considerations. We've talked about cost, palatability when we're choosing a milk. How many ways can we use it? Is it good for baking? Is it good for drinking? Is it good for cereal? What's the flexibility of that product? Can I buy it at my local store? Is the cost prohibitive? Is there a way through the amino acid-based formula companies that I can apply for financial assistance? All of them have a financial assistance program. Can I ask for samples? So again, it's a big picture. So make sure you're working specifically on your needs with your care team. And when we eat, we want to be eating all of these things with intention, which is why we're choosing a milk with intention, which is why we're choosing a diet with intention. And we know that research tells us that grazing, which is super popular among the little kids, but also if you have symptoms, you might be a grazer because you can only eat so much food at a time. And grazing, research shows us in the non-food allergic patient can lead to excess weight gain. But how does that really work in EGIDS? I know we briefly touched on obesity because of those 300 calories to 300 calories, but let's look at some different examples. So this is standard, probably have it in most grocery stores, coconut milk-based yogurt. It's sweetened. And when we look at this one compared to if we did an unsweetened version with a go-go squeeze pouch, which I find to be super popular, then we have been able to increase the fiber, decrease the sodium, eliminated the added sugars, and actually we're able to provide less fat and increase calcium. So just a quick swap, still with lots of flavor, and those pouches come in lots of different flavors, including like the toddler pouches or the infant pouches from any other brand would be wonderful to mix in. If we look at a frequently eaten after school snack and we compare the sodium, fiber, iron, and fat, what if we choose those hippies? Because as I mentioned, chickpeas earlier. So we're getting a little bit more protein, more fiber, less sodium. Yeah, it tastes different. And it doesn't mean that we're not doing veggie straws, that we're not doing the sweetened yogurts, but it gives us a little bit more option. Same with macaroni and cheese. If we were to easily switch brands and go from the ready prepared to one that we have to prepare ourselves, we reduce the sodium, the fat, increase the calcium. So small changes can really add up through the day. We've got our popular go-go squeeze again, but what if we pair that with the sweet potato parsnip pouch or switch it out to even be in the yogurt? More fiber, more iron, more calcium. Gluten-free chicken nuggets, I think, are like a super fan of these because they really promote quality of life. But when it's interesting when we look at the gluten-free ones versus the standard ones, there's less sodium in the standard ones and more protein. So obviously, if you're avoiding wheat or gluten, then you're not going to be eating the standard ones. But is this an opportunity to make them at home? It's super easy and fun. And I have a recipe in one of the formula recipe books where I made homemade chicken nuggets, and my kids really enjoyed them. Also, I think rather than take foods away, I think about what I can add. So if we had that chicken nugget, why don't we add a waffle with some fruit and veggies? Or if I was making the macaroni and cheese and I put that pouch of the sweet potato in it, that would enhance nutrition, but it's still orange, and it wouldn't really modify the taste. So at meals, I think at least 3 different foods, 2 different foods with snacks, and be considerate with the color, texture, and temperature differences. Just a little reference information for added sugar and salt as you're looking at a label, thinking about the age of yourself or your child and what those recommendations are based on the dietary guidelines for Americans, which is actually going to be revised because it was through 2020 and 2025. So stay tuned for the update. This all also goes to feeding the microbiome. And there's a lot of talk recently in recent years about the microbiome and its effects on diseases and wellness and health. And so when I'm teaching patients and families about dietary modifications and the quality of what they're eating, I'm also thinking about the quality of their microbiome and keeping it as healthy, happy, and thriving as long as possible, because this will affect our overall longevity. And we're looking for sources of increased fiber, thinking about the vitamins and minerals. Are we eating foods that are nourishing our guts rather than potentially contributing to some of the gut damage? And then as we're gathering our ingredients, this kind of goes into the gut damage. But really, I think damage is an extreme word. I think that while all foods may fit, some foods fit better than others. And ultra processed foods in the microbiome, we're hearing more and more about it. But the data calls an ultra processed food something with 5 or more ingredients that aren't the typical foods of salt, sugar, oils, and fats. They have many other ingredients like the emulsifiers or artificial sweeteners. So just being a savvy label reader. If you want to eat your favorite snack from childhood and it's safe for you on your allergy avoidance, but it has some of those ingredients, okay. But you also know that now you're making different choices with your fruits and your vegetables and how you're jazzing up your meals with more additions to increase nutrition. So fiber becomes part of that delicate system in your microbiome where it helps to increase the good bacteria and helps to decrease the less than ideal bacteria. Then we have dietary supplements. Some of these even feed into the microbiome portion of it. But what's important to remember is that the FDA does not approve supplements prior to marketing, and you should be really working with your healthcare team on selecting the right dietary supplement for you. And a multivitamin is not it's not usually what we'll choose. We'll try to be really targeted in our therapies. The financial considerations we also take into account. So we know that it costs to go to the doctor. We know that groceries are exorbitant and even more exorbitant if you're on a food restriction. We know it takes time to schedule your appointments and get the gas to get to your appointments to and from, the time to schedule. What if you have to book a hotel to go see your provider? So we're taking all of this into account while we're thinking about the cost of your supplements, while we're thinking about the cost of your plant-based milk, and those additions to your food to enhance the nutrition of them. So I put a simple, pretty, I think, standard what somebody might enjoy menu up here to show you how you can use foods that you would enjoy most days and kind of rework them to fit into an allergy-friendly diet. And then when you've got this allergy-friendly diet, like initially we hear what you're eating and drinking in that initial dietary assessment. I like to do a secondary dietary assessment when the patient is on their diet therapy, because now I know what you were eating, so I get a gist of how to support you moving forward. But now I know what you're going to be eating moving forward. And this allows us to make even more directed recommendations for brands, foods, supplements, so that we're making the most of your budget and we're making the best use of your time. So we're all thinking about all of these moving pieces together, and we really appreciate the part that you play in informing us of your needs, keeping us looped in. It's okay to let us know that something didn't work. I always say the most offensive thing a patient can do is tell me what, not tell me what's not working, because I want to be able to help. So we're truly all in this together, and we appreciate that you trust us to help you, and we're very grateful that we can be part of your journey. So thank you very much to Cured, and thank you for all of you listening.
Thank you so much, Raquel, and thank you for all of your knowledge and sharing it with everybody. We do have a few questions
Sure.
from the audience. The first one is, for young teens who do not want their food regulated, do you do food coaching?
Absolutely. That's like, I think that's standard teenage behavior. And then it becomes so it's standard, but then it becomes even more intricate when they don't want oversight on these, what they're eating and what they're drinking. And especially as teenagers get older and older, and we want them to stay close to us and rely on us, it's our job to teach them even small things like, where is your insurance card? What pharmacy do you use? Who do you call and when you're an adult and you're on campus and you need emergency services? So I kind of tie that into the whole flying the nest kind of like counseling session, because it's really our job as parents and clinicians to support and manage through each age and stage, which has different external factors that play into it. So absolutely, I love seeing those patients.
Thank you.
Thanks, Raquel. The next question: should EOE boys not take soy milk because of its estrogen content?
I appreciate this question. And for those who have tried to sift through the answers that you'll find online, I'm sure they're very varied and you can really see both sides of the coin. I do not tell my teenage boys or young men that they cannot have soy products. I think that there's a lot of data that supports the protective components of soy in the diet, but going back to my general goal of diet diversity, including all different colors and all different sources of proteins, it would be the same standard of conversation with what else are you eating? Because soy only has, one type of protein. So where are you getting your other proteins and your other nutrition from? But it's not something that I advise against, definitely not against.
Thank you. Do you consider drinking aloe vera helpful? Does that fall anywhere on the food guidelines?
Aloe vera is an interesting herbal remedy that people choose because I think it's soothing for maybe some of their symptoms that they're experiencing in their throat and their esophagus. We don't have any data to support using it. And I don't advise it for my adults or my children, but I'm pretty strict in what feels okay and not okay based on the data that we have and the safety guidance that we have in our pediatrics. So I advise against it, but if you're an adult and you choose that, then I'm still going to advise against it, although I can understand where you're coming from with the soothing effect. And talk to your provider about other medications or topicals that could help to provide that same impact.
The next question is, how does one recover psychologically from being repeatedly hurt by food? Is it possible to restore a normal and healthy relationship with food?
The short answer is yes. It is very possible to restore a normal and healthy relationship with food. It takes the right provider, so the right therapist, psychologist, um, the level of care that you need, and really investing your time and energy into it. It is a lot of work. There are programs that people will go to at, usually it's an eating disordered facility, but that way they have an inpatient program or a partial hospitalization program where they get to spend really focused time working on their specific needs. If that's not the right place for you, or you don't quite feel ready to commit to that, working with an eating disorder therapist, similar to where RFID is, and repairing that relationship. Not that all that have feeding difficulties have RFID, but working with that type of therapist who really understands the challenges of food not feeling good, and how to cope with your new comfort in food, despite all of the traumas that you've experienced in the past with food. So there is absolutely hope, but it requires a lot of effort on both parties' part.
Thank you. Any recommendations for an extremely picky eater?
Extremely picky can be going from feeding difficulties to have we not uncovered a disease or a diagnosis that's going on. I love partnership with speech language pathologists and oral occupational therapists, or a feeding evaluation that can be done to see how assertive we should be as dietitians in trying new foods. But knowing that the patient doesn't have RFID, I think the best recommendation is just exposure and understanding that taking a bite of the food or touching the food or smelling the food is okay. They don't have to do that. If they let it live on their plate, that's a victory. And it can take double-digit numbers of exposure to a food before a child will go through each stage of acceptance or allowing it to become touched or smelled or bitten.
The next participant would like to know, what do you think there is some relationship between histamine food and EOE?
There is not a relationship between histamine foods. I think the question is specific to a low histamine diet. We don't have evidence on this in general in the peer-reviewed literature. And so therefore there's no evidence with EOE or EGIDs and the histamines in foods.
Is there a relationship between having oral allergy syndrome and EOE? Could the triggers for oral allergy issues also be triggers for EOE?
I think that question would really benefit the discussion with your allergist or your GI. Seasonally, you might find that your throat becomes more itchy, or your mouth becomes more itchy. But my knowledge specific to an endoscopy is pretty limited. So discussing that with your healthcare provider, clinically, as far as I practice, we're not restricting those things, but because they do cause oral itching and discomfort, we definitely always recommend that they're provided in their cooked or pasteurized form.
Are you familiar with high histamine foods increasing symptoms and therefore benefiting from a low histamine diet? So kind of echoing that last question.
I'm not familiar with it. We don't have any data, literature, case reports on a high histamine diet having impact specifically on EGIDs, but also in other diagnoses.
Are there any specific foods that would heal gut inflammation? And if so, what are they?
So oftentimes gut inflammation is driven by the diagnosis. It can be IBD, it can be an EGID. There's a compilation of different diseases that can be active at the same time. From a dietary standpoint, the Mediterranean diet is often the recommendation from an anti-inflammatory status, which is also used for arthritis, rheumatoid arthritis, and other inflammatory conditions. But there's not a specific food. It's more so the complex of foods, like we had mentioned, fiber and appropriate vitamins and minerals, and diet diversity that can be most impactful in keeping your gut integrity intact.
Can EOG affect the GI tract in the same way celiac disease does?
Not to my knowledge. Celiac disease is a very separate condition than EGIDS in the way that it manifests, and is very different in its nutritional needs, and the healing process and treatment look different as well.
Thank you so much, Raquel. Thank you for being here this evening and being part of the Cured family. I know the patients appreciate you so much as we do. I also want to let the patients know that Raquel not only sees patients in North Carolina, she does Zoom visits, so you can live in other states and be a patient. So you can find Raquel's information on the Cured website at www.curedfoundation.org. Look under the professional list and then her state, North Carolina. Again, thank you so much for being here.
Yeah, of course. Thank you guys very much.